Thank you, Mr. Chairman, and Mr. Secretary, thank you for joining us today. I appreciate the comments you've made about the Rural Health Transformation Program. That is something many of us worked on, and we were pleased to push that out of this committee, and I know Dr. Oz is moving forward with implementing that. I appreciate your comments to Senator Warner on the area wage index. He and I have worked on fixing that, and we appreciate your attention. I am delighted to know that you're going to end the revolving door and the conflicts of interest. I have found it so unseemly that people who work with a pharmaceutical or with a big food company then go back over into CDC or NIH or FDA, and then they're signing off on regulation for their former employer and many times their future employer. So we appreciate that. Senator Langford went to you on the PBMs, and as you are aware, my PBM Act that Senator Wyden worked with me on, that made it out of this committee last cycle. And making certain that we keep these rural pharmacies open, making certain that PBMs do not profit above what is their standard service fee, and that they have to disclose all their pricing. That is going to be an imperative. So will you work with us to get that PBM legislation across the finish line and to the President's desk?
Yes, Senator, absolutely.
Thank you. Interoperability is something that you have announced, a new interoperability framework to better align data sharing principles. And this is important to digital health. And as you're aware, when we passed 21st Century Cures in 2018, the Software Act and that health IT definition is something that I worked tirelessly on to get implemented. So what I want to hear from you is, how does CMS plan to align this new framework with the existing federal framework, and how are we going to be able to move forward with one national policy on interoperability?
Well, I don't know if we, what we have right now is concrete commitments from the 60 top tech companies who we were able to convene to do data sharing, to do patient accessibility, and to do interoperability. But I can't tell you how that's going to mesh.
Then if you will have someone submit to me in writing what that pathway is, this is something that is essential if we're going to be able to benefit from that data. So having some specificity on the pathway will be helpful. I did want to talk with you. Last time you were here, I talked about the concerns on overprescribing prescription stimulant drugs for children, and there are ways that HHS can work collaboratively with state agencies on this and to actually promote more community-based intervention to combat overprescribing. And we all have seen the harmful side effects, and there's a lot of reporting out there on this, and tremendous concern for grandmamas like me who see children and friends of our grandchildren who suffer with this. So I know your team is working on solutions, so you're going to have your Make Our Children Healthy Again strategy that you're going to release. But talk for a moment, we've got 30 seconds left, talk for a moment on how you can better arm parents with information on the harmful side effects of overprescribing these stimulant drugs.
I mean, one of the problems, Senator, is that, we now have 1 out of every 5 kids on these drugs and the antidepressants, even more. And we know very little about the long-term impacts because NIH and CDC have been asleep at the wheel. Right now, we are doing those studies. We're doing extensive studies so that we can warn parents and so that we can force the companies to put labels on their products. And, we'll do whatever we can to show that, just to get data out to the public. That's really what our function is. And to show what the long-term impact of some of these drugs is. Are we actually preventing suicide, or are we creating more suicide? And that's something that we don't know the answer to, which is, how did these drugs become so common in our society without us even knowing the answer to those questions? That is malpractice at these agencies, and that is the malpractice that I am going to fix.
Thank you.